Hello and welcome to the Auditing Antics podcast. Now today we're going to be going over some live Q&A, some questions, and we've had some things come about, or I should say I've had some things come about recently in some private group forums that really have me thinking about today's episode a lot differently. So we are going to start with a little bit of what I keep telling Michelle is going to be my rant for the day because it was just horrifying what I saw in this particular thread in a forum. And Michelle, what happened and what I went through this past weekend in this forum really opens my eyes as to how much people need support and resources, and how even employers, there's times we've talked about where employers don't even want to pay for a Codify subscription or
Mm-hmm.
Encoder Pro or things like that. If you are having your staff coding and auditing, that should not even be negotiable. And
No.
the types of things that I saw going on in this forum, which I'll talk about in a little bit here, were just so mortifying because there were so many people who appeared to have a lot of experience, and or they thought that they did, and the person asking the question was totally in the dark, and it was just a nightmare.
And also, just from the other side of that, it's great to ask these questions and things like these forums, but you really need to know how to do your own research.
Mhm.
Forums is not the place that you get concrete answers from or take advice like hard and fast coding advice from.
Right.
I've always said it gives you a jumping off point. It points you in a direction that you need to go. Because how many times do you look at these questions that are being asked and then you look and there's like 7 different types of answers?
Mhm.
Well, which one's right?
Right. Well, and I
And
have to say, with AI being implemented into like Google search, for example,
yeah,
it actually can kind of point you where you need to head. It doesn't mean that we Google it and take the answer from the surface level, but it has some pretty good information where you can at least have a starting point and go from there to
it
validate it.
does. And I feel like sometimes we lose sight of the fact that it really is up to us to gather the information from the official source ourselves.
Mhm.
And meaning that is, even if, let's say, you provide an answer, Stephanie, somebody asks you a question, you provide an answer, you provide a source, they need to click on the link to the source and go look at it. Don't just
Mhm.
say, okay, Stephanie told me it's good. I mean, I'm guilty of that because you do know your stuff. You are the ultimate resource for questions and answers when it comes to me.
Well, you get the sister treatment, so
I know. I'm special. I'm a VIP. Um, I've put up with a lot from her my whole entire life, so I deserve the VIP treatment. Okay, people, it is payment. Um,
I'm making up for our childhood, but we won't tell the stories.
it's payment for silence. But no, like you have to be able to know how to go find your own answers. These forums
Yeah,
aren't the place to get your hard and fast answers where you make actual decisions based on those. Use it as a jumping off point. But I think a lot of times people have just gotten into this comfortable habit of, we're going to put it out there, or this, I'm not finding the answer that I want, or something's not black and white saying what I need it to. So you need to learn how to look at what you have there and know something doesn't have to say it in black and white for it not to be present in a broader picture, or know how to take that broader picture of what's being said and apply it to a very specific topic. And I think in this
right.
situation, that skill was totally not there for the people that were
Yeah.
responding. I was reading what, this thread was, and I was like, they
You want to say so many
They're
things.
doubling down on that, I guess. They're
Well,
confident
so
in
we
their
prep,
error.
but what you were just saying, Michelle, is exactly why I set up what I'm calling the medical coding workroom. So let's
Hmm.
talk about that for a second because I
Yeah.
haven't really advertised it too much. I just put it out there once. But there's a lot of people in the industry, and I'm setting this up with two different groups in mind, but it really can be used by anyone. So
Hmm.
one is for people getting into this industry that need a good base foundation. Because, like you're saying, you should be learning to research from the beginning. That shouldn't be kept only for people who are auditing and educating, it's for
No.
everybody.
Yeah.
So, if you're starting in the industry and if you want to learn the base skills, but also if you want to start learning how to get into other specialties. So a lot of times there are seasoned auditors, but they've worked maybe two specialties or five or whatever it may
Mhm.
be. And I'll get questions a lot, well, how do you work so many specialties? And if you have base skills, I'm telling you, you can work anything
Yeah.
because you stick to your official sources, which would be starting with AMA, going to CMS, and then on top of that, layering commercial policy if it's a different plan or state policy.
Hmm.
So there's very specific things you can follow, framework you can follow to learn this stuff. So the medical coding workroom, and I'll put a link into the notes section because I've only put something on the screen here for the main membership. But the coding workroom, if you're interested in learning that, and if you don't have a large budget, that's just 10 a month. So I set
Yeah.
it up specifically in a way
That's
where it's
very.
not going to be high cost. Right now, there's about four different videos, and what I do is sometimes we walk through individual encounters and break them apart, but then I also show you on the screen how to research it, how to navigate the CMS website, how to find these official resources. And I'm actually getting ready to do a telehealth one, so that'll be on there
Oh,
soon.
that's excellent.
So if it's something you're wanting to learn, you want to check it out, just $10 a month. I'm going to be adding at least one subject a month to it, so keep an eye on that. Now, with that being said, I did link onto the screen here for those that are watching at stephanieallardconsulting.com/membership. You can put in the code Auditing Antics 26 for the full membership, and that's actually the biggest discount I've ever done as well. But I thought it was appropriate, 26, year 26. And, people really need this compliance support. And I'm hoping people will consider it, even if it's just something where, a practice can get one membership, have me as someone that can help out. So with that membership, you do get access to live Q&A. So just like we're going to do in today's episode, you can send a question to me. I do answer that within 24 business hours. And I find a lot of people are liking that particular component. We also have, or I should say, I also have other educational tools on there that I've created, depending on specialties, E&M, things like that. A couple of on-demand webinars available, and then also the medical coding workroom is included in the main membership. So that's something that, I really want that membership to be a resource, but also there from a mentoring perspective. So
Hmm.
it just made sense to add that workroom right in there because it's part of those goals. So
Yeah.
we'll
I
move
think,
on from the big ad,
well, I
but I
just want
wanted
to,
to make sure that people know that this is out there because sometimes I don't do a
yeah.
good job of pushing that, and not everybody knows that that's something they can sign up for.
Yeah. I just want to say that when I first started coding, I didn't have a whole lot of resources available to me. And you have always been my mentor in this industry, and that has been very beneficial to me in that while I didn't have those resources, you were there teaching me those skills of research and finding that information and laying that base for me to get my own information and make my own interpretations. But the fact that you have that resource through your membership or even through the workroom, like having something affordable is huge.
Mhm.
I know there was not much out there when I first started. I do feel like there's a lot more available out there now, but having something at $10 a month, I think that fits in a lot of people's budgets that would really make it worth it to get that extra level deep dive. Like, how many times do we watch a webinar or we see like somebody's going to be presenting on this topic and we're like, oh, I know for me, I'm like, this is awesome. And then it's literally just the very surface of stuff we
Mhm.
already know. And they don't take the time. Like, nobody wants to give a personal opinion, for example. Nobody
Mhm.
wants to break it down for fear that it's like going to come back and haunt them. But that's something I know you do. You take that deeper level. You don't just keep it on the surface. You don't just talk about what's in the guidelines. Like, we'll use E&M, for example. You're going to break that apart and you're going to not only tell them what, but you're going to tell them why and how you've interpreted that and why you've interpreted it that way. So
Mhm.
I think it's a really extremely valuable resource that people should definitely look into, and having access to the Q&A alone, that's amazing. If I had had something like that, which I did, but I didn't, like, I couldn't just call you up 24/7 and be like, "Stephanie, answer my question, solve my problem for me." Like, if I had had access to something like that, I totally would have taken advantage of that.
Mhm.
So excellent resource, even if like for your membership, not the workroom, just the membership alone, that Q&A portion.
Mhm.
That's huge. Huge value right there.
Yeah, and I did forget to say too, we do one live a month where whoever's available in the membership comes together, and it's just an open discussion. So I'll start out with what I'm seeing or what I'm concerned about in the industry, and as people join in, we just have conversations. We do live Q&A right there, and people sometimes will chime in like, "Hey, I've dealt with that too. Let's talk about it." So it's been fun, and that's definitely a goal that I've had in the industry in general, is to put myself out there more now and start mentoring and guiding people in some more hands-on ways.
Mhm.
All right, so let's go ahead and jump into our first question for the day, Michelle.
All right. So, question one, current state. Our psych providers are performing psych testing over the span of multiple days. Ooh, psych testing. This is something that's so confusing to me. I'm not even going to lie about that. Ooh. Um, First two appointments consists of testing, and the last appointments consists of feedback and treatment planning. CMS LCD states all testing should be billed on the last day, day 3. My question to you, do we report each CPT code with the date of service that reflects when testing was done, or should all charges reflect that last date of service?
Yeah, so this is a really good question, and this is something that was very confusing when AMA updated psych and neuropsych testing years and years ago. I think it's been gonna be been over 5 years at this point. But with the transition, it was very confusing because there are parts of it that you essentially have to save, quote unquote, to report together. So the way that I like to look at this is we put it into buckets. So we have the codes that represent the administration or the patient that is taking that test with the automated scoring or however that's done, depending if it's electronic. So we have test administration, and then we have what comes once the testing is complete. So if you can do this in different ways, but if as a practice you want to try to build some of that out and not hold all of it for the very end, what you could do is you could bill the testing, but you can't break that apart. And what I mean by that is, remember that we have a primary code for psych, neuropsych testing. We have an add-on code for additional time. So if that patient takes multiple days to complete testing, for example, you can't bill it out on day one because you're not done with everything. So you can capture everything for the test administration, get all of your, your primary code, add-on code with units depending on how long it took. Go ahead and build that out, just testing. Then the part that is even more confusing to a lot of people is, once testing's complete, we have a set of codes that represents the evaluation portion. And included in that, so if we think about this from the provider standpoint, included in that is going to be a review of all the tests that were completed, their interpretation, meaning their review with a written report, the outcomes, so diagnoses, making the treatment plan, and then also what they added into that code description. If you're billing the 96130, for example, they added into that code description that it also includes feedback and education with the patient and or family. So with that next one, the provider would have to know to track all of the time they're spending. Say the day before they're seeing the patient and family, they go in, they review everything, they write up their report, they get ready. They've got to track that time, add it to the time that they're spending with the patient. When that patient visit, face-to-face encounter is done, for example, they're carrying out a treatment plan. That last day would be your date of service, and then you build that out appropriately with the primary code, add-on with units, all of that. So, and I didn't answer that with the testing. When it's in that scenario, if the patient has 3 days of testing, you wait until the third day. When testing's all done, the last day is your date of service. You can go ahead and bill it out. And one thing that is really helpful when you look at this code set, and I'll actually pull this up really quick. When you look at the code set, it is something where the code description does a pretty good job telling you everything that is needed. So that I do find is definitely helpful.
I think what I get confused the most about these is often they aren't documenting the times separately for the test
Yeah.
administration and then the evaluation. And then so I'm auditing an encounter and I have all these CPT codes that have all this time, and it's like, well, how do I know you documented this total time, but how do I know how much of that was allocated to testing and how much of that was allocated to the review and interpretation and meeting with the patient and all of that. And I think that's my biggest struggle with them
Mhm.
is the provider's not documenting it so that, like, to me they should
So
have
that it
separate
matches the code.
documentation for
Yeah.
those things, because you're billing for two different things. You're billing for the test administration, and then you're billing for, and sometimes the test is done by a technician.
Mhm.
And aren't there separate codes for test
Yeah.
administration by a technician versus the provider themselves and all of that? So I feel like that should all be broken down in their documentation, and
Mhm.
that often is the missing piece for the psych testing. And I think that's where I get like so confused
Yeah.
from it, is because they aren't separating out the different pieces. So it almost seems like it might work better for them to bill testing administration when that section is done, and like do them separately instead of trying to do everything all together at once. And then, do you really have compliant documentation, because you can't tell if the administration time that they're reporting is supported versus the provider's work of like the
Right.
review, report, and assessment.
Yeah. And that would be a problem. We wouldn't be able to support it because we wouldn't know the difference. And I've seen that. It can depend a lot on different variables, but the biggest thing is workflow can affect this. And
Hmm.
then also, however, you're documenting it in the system. There are different programs out there. One that I've seen a lot and worked a lot with is Clinicom. They actually have things built in there where it's the tests themselves, the patient's going in, it's tracking time, it's doing a lot of that for the practitioner.
Yeah.
But in an EMR system, or if it's manual on paper, things like that, it's going to look very different. So really quick to the two code sets you were referring to with testing, we have 96136 and 7, which is when that is being administered by the physician or provider themselves. Then we do have technician, which is 96138 and 39. Sometimes I get asked the definition of provider versus technician. It can be very dependent on payer, especially if it's a state Medicaid administered plan. They will have different definitions as to who they allow be a quote unquote provider. So initially, you can look at that as physician or NPPA. And then if you have like a psychologist, social worker, counselors, things like that in your practice, you need to look beyond that into your payer policy to see if you can count them as a provider or you'll need to count them as a technician.
Mm-hmm. So it's not just cut and dry. It kind of goes back to what we started off talking about. And this is a prime example of why you need to know how to do that research in those layers that you have to understand
Right.
of research, because we can see a certain thing from the AMA, which are the code descriptions, and then we see from CMS what they have, and then commercial payers are going to have a whole range, and then like you said, state Medicaid, what is considered even like the scope of practice for some of these people as far
Mhm.
as the state goes and things like that. So this is a good example of what you had already talked about on why that layering of research is necessary, and you couldn't just go to a forum and ask somebody this and them give you an answer that's going to be usable for you, because they don't have the same payer um, contracts
Oh
that you
yeah.
have.
Yeah, that one's hard because you really have to look different. I always give that caveat when I talk about that. I can't give a blanket answer because it's going to be
Mhm.
different.
Yeah. Okay, so are we ready to move on to our next question?
Yep.
I personally think this is a good one because it is something that is been it's something that I have been seeing in my audits, and honestly causing me a lot of grief. And so I'm happy that somebody submitted this question. Um, so we are an orthopedic group and we have a large UHC patient population. What should we be doing right now to prepare for the upcoming changes that will require a radiology interpretation report? And I think it's really interesting because what I'm seeing right now isn't even what would support radiology interpretation, like billing separate for it.
Mhm.
So like this new policy from UHC, wow. I mean, even bigger issue.
Well, and can you give an example? I know that we've talked about how bad this is before, but can you give an example of what you're talking about? So when we see this in an E&M progress note, the
Yes.
physician, for example, is meaning to get credit for the
Yes.
interpretation, but what do you see in the note?
So we're just seeing a little blurb that,
Mhm.
because I'm aware of what's going on, I know the provider is meaning this to be their interpretation of their x ray that they're billing separately for, but they aren't including all of those elements. So when we're billing for radiology, there has to be that separate note, whether it's within our current progress note or in a separate area of the patient's chart. Like I know sometimes we see in Epic, for example, there's an area where they can document their x-ray interpretations and things like
Mhm.
that. But in this instance, the providers aren't using any sort of template to do that, and they're just including literally in their assessment plan. It's just like this little blurb about what they saw on the x-ray, and it's not anything that's a standalone document that could be used to support
Right.
billing for that x-ray. So meaning name and number of views, having an indication for a diagnosis for the x-ray, not even like today, like x-rays today show, things like that, to even know when these are from. So not that specific layout that we have to see, that separate, no, I say like this because I'm thinking of that data section
Yeah. Yeah.
in the
Yeah.
documentation, you know what I mean? So I think it's something that is probably an issue elsewhere, especially in things like orthopedics.
Oh
And
yeah.
providers don't think it's necessary to have that separate documentation to show, um, to receive credit. They just think I've done an interpretation, I'm good. But they're missing that name and number and type of views taken, the anatomical location of the
Mhm.
imaging, the diagnosis and reason, and then that actual interpretation with the description of both their, the normal and their abnormal findings that
Mhm.
they are seeing. So like that actual note showing their interpretation. I think they think because they're just writing out a little blurb that that is sufficient
Enough.
to bill that x-ray, and it's
Yeah.
not.
Well, and so what this question is referring to as well, in case people are not aware, with United Healthcare, they've announced that at the end of the first quarter, they're going to be enhancing a policy that says that you have to have a separate interpretation report if you're billing globally for imaging, or if you're billing with a 26 modifier just for the professional interpretation. So, like Michelle was saying, a lot of times we'll see in the outpatient, the office setting, we will see that our physicians and practitioners are wanting to just put their findings into the E&M note. And a lot of them leave up that detail Michelle was talking about to assumption, which we
Mhm.
can't do. It really is an area where if there's that little documentation, it could easily be questioned on an external audit. And when I read that from United Healthcare, the first thought that I had is that, of course, they're doing this policy because of the lack of detail they get up to this point.
Absolutely.
So now they're saying, okay, well, we need this information. You have to have it in a separate interpretation report. And the other thing they're going to be doing is within this update, they're talking about implementing smart edits that are going to prompt the documentation to be uploaded before reimbursement. So this is going to be something that you can't get around. From what it seems like, it's not like they're going to be randomly selecting claims to check. It sounds like that's something that's going to have to be uploaded. So we need to start having conversations now,
Absolutely.
because we know that physicians, practitioners, they're not going to be happy if they're only doing the E&M and they give you crap every time you do an audit because you tell them it's not enough documentation. It's going to be that much harder when the time comes in April.
Yeah.
So make sure you're having conversations now. Get it out in writing if you have different tips of the week, newsletters, if they let you join monthly meetings, quarterly meetings,
Mhm.
whatever you have to do, talk to the practice administrators, lead physicians. You need to get the word out and have them talking about the change, but you also need to be working with whoever your vendor is if you don't have it set up for a separate interpretation template. You may need training as well so that they understand the workflow. I'm thinking about like Epic, for example. That could be a pretty big workflow.
I
So,
I was just thinking about that because I don't know how many times when I'm auditing an Epic and I'm looking for an X-ray interpretation and I'm not finding one, and I go under that imaging tab and it says see document E&M doc or see office visit for interpretation today. And it's like, there is no interpretation here. So
Yeah,
not only do you need to have these workflows in place, you need to make sure you need to be having checks and balances in place to make sure they're not getting around it by doing something like that.
that's a good idea because they definitely will try.
Bec- because I
Somebody
think
will try
that
it.
that's already the intention. Like, obviously, it is. I don't disagree. Even from an auditing standpoint, it is easier when it's just a separate part within their note. But unfortunately, it allows for bad habits and things to be. I mean, we all know providers talk amongst themselves. How many times have you gone and done a
Mhm.
physician education and they're like, well, Dr. So and so doesn't, and he's allowed to. And it's like, well, Dr. So and so is not allowed to. He
Right.
just thinks he's getting away with it.
Yeah.
But it's always hard to make a change, but it's important you're getting the information out there, but don't just assume that they're taking that information and saying, okay, yeah, I'll do it, instead of, I mean, trying to find a way to get around it.
Mhm. Yeah. Okay, we can go to the next.
All right. So our next question is, in audits, when a coverage or billing decision involved a software tool, what specific evidence do auditors expect to see to prove a qualified human reviewed and approved the decision, just or beyond just a signature or note?
So this is a really good question. You and I both got this one and we were talking about it. It's something where we have to remember that embedded in these systems is what's called an audit trail.
Hmm.
So if there are things that are questionable about how software is built or how somebody's using a system, there's a lot that can be done on the back end with it's not something I obviously would know how to do. It's usually something I request if I have concerns. But the systems have ability where it's tracking and tracing what you're doing inside of that system. And I've even had a situation with one particular client where I could view video and I could watch the provider move through the system as they were documenting, selecting the code, closing out the encounter, and pushing the charge to billing. So there's different ways it's done. More commonly, it's not going to be a video, it's going to be that
No.
audit trail where we can see the movement. But that question also got me thinking. We didn't have much more context behind it, but
Yeah.
there's times where there are concerns about whether or not the software is doing too much.
Yeah.
And that's one thing I was thinking about when we have things like auto leveling, or we have a lot of implementation of the the language learning in a system
Hmm.
where it's trying to identify keywords that a coder may want to see or that may help things like that. Go ahead.
Well, I just got to thinking like about AI and how much of that is being implemented in here, like within the software that's being used, and things like automated billing and things like that, where
Mhm.
it's potential that this software could be scrubbing for, like you were just saying, keywords, but instead of it being like keywords that a coder wants to see, like a keyword, and saying, oh, we're going to bill depression screening, or you know what I mean, or smoking cessation, and it's not taking into account the actual documentation requirements. Like,
The
I really struggle
context.
with some of this because the information is only as good as the person entering it.
Yeah. Yep.
And I know even before AI has become really popular, you and I have worked on projects with EHR systems that were selecting the level of service. And when I was auditing on that project and going in, like, I had access to see what they leveled it as. And then I was able to go into the documentation, and as I was auditing, explaining why what the automated program selected was incorrect, and it all came down to what the provider was entering. So
Right.
it it wasn't even technically automated, in my opinion. Was it was only as good as what the person was entering in.
Well,
So,
and to give some context there, so with certain systems, for example, yes, it can pick up on, keywords. That's kind of newer technology that we have. But even before AI and things like that, there was different things where it would say, okay, are you addressing a chronic condition today? Is this an acute
mhm,
complicated problem? And within the user side of the system, they would try to prompt the provider through those steps that would correlate with the guidelines. But then, for example, I remember having to train an entire group of nurses and NAs because they were the ones doing the intake with the patient. And the intake and the HPI and the reason they were there and all of that was driving parts of the system leveling the E&M service. And they were constantly undercoding. And I was like,
uh-huh.
what is going on here? So when it was broken down, like you were saying, trying to get some of that audit trail information to know what the system was prompting, but then understanding the workflow to know where the disconnect is and where to go
Yeah,
back. So that's ways to identify and work through it with education. This person was asking more so,
like
is this
automated.
something that happens? Can you see that? And I will say, when I've worked in different cases where it's either been, a legal case or some kind of concern internally in an organization, so I help with some of the reviews being done. There's instances where, for example, if you log in, or I've seen practices, they literally have one login and they force everyone to work under one login. And then the person that is their access information, they're trying to hold them accountable for all of these errors that were made.
Yeah,
Or I've seen, an APP practitioner trying to get held liable because the notes made it look like they were acting outside of their legal scope of practice, but they weren't in the system noting, but it was their access, their login. So digitally, it all looks like them. So we have to remember that this is just like anything, I feel like it's when I talk to my teen daughters and nieces, it's like this stuff on the internet is going to stay there, right? This stuff is
it's
in there.
forever.
I don't know how it works, but it can be pulled out of there, and I've asked for it and gotten it before. So, you do want to be mindful of that. And if that question was referring to, automated tools going too far, I would say yes, that's definitely a concern. That's something that, in the consulting work I've done with different developers, that's a part of what I've been consulting on is making sure that not only you're trying to stick to the regulations and the guidelines, but are you giving enough autonomy to the user of the system, or are you forcing them into a bucket because they clicked this or clicked that? That's
Yeah,
going to be a problem.
yeah. Okay, so last question here. And
Here
this
comes
is
my soapbox.
this
Go
is going to
ahead.
be a soapbox,
Let me
folks.
stand up here.
Preach it. How do how do I enter a charge that is free? The physician does not want it to be charged.
Okay, so the reason we're laughing, let's give some context. And poor people, I'm sorry I have this platform and I'm going to use it today because this annoyed the crap out of me and it was just so frustrating to even see what was happening from a professional level, from an industry level. It was really discouraging to see what went on. So what happened was on the weekend, which I got to get out of these groups. I don't know why I'm in them, but I try to stay away from forums. But I am on Facebook. I'm a part of the AAPC forum. Like, well, it's a private group, so
Yeah,
it's not something
yeah.
that's public, but it is private. And I will say, to give some caveats here, they do have almost 60,000 members in there. There are a lot of moderators. It's the weekend. If you think about it, they can't realistically screen everything. And
No.
they even have things in there that say, due to the size of the group and all of these things, we can't guarantee the information's correct. And, all of these rules laid out. But we all know that in those forums, we have a lot of bad information.
Oh,
And
yeah.
I had seen this question that Michelle just stated about entering a free charge, and no one else had really answered. And I was sitting there drinking my coffee in the morning, and I was like, oh, I'll answer it quick. I'll let them know, you got to have certain things. Well, it blew up into a nightmare. And, to give some additional information there, the first response I had of like 10 was that you can't just give free charges. And we're going to break this down in a minute here after I finish my rant about this forum. But in this situation, there were so many comments. I can't even tell you the total number of comments, but there were probably close to 100. And sorry, I can't get this phone call to stop. There were close to 100
They're
comments
calling you about your car's warranty.
They're
Of the
listening.
utmost importance.
But there was almost 100 comments in there, and there were all these people that started to like attack the comments I was making. Now, mind you, I gave a very clear answer, was pointing to specifics that needed to be in place from like a workflow perspective, compliance.
Yeah.
And all of these people come on and they're like, LOL, that's not true. You're not saying the right thing, or you're wrong in so many ways. And, I started to get really frustrated because.
Hang on 1 second.
What?
If you're going to be like, you're wrong in so many ways, please tell me those ways.
I know.
LOL.
Well, and that's what was so frustrating is nobody answered this person with actual guidance. It was opinions. And the one woman who was the most obnoxious in the responses, I looked up her account because I'm like, oh my gosh, like, where does this person work? This is awful that she would even direct people these ways. Then I'm like questioning, this is supposed to be a professional forum. We should be supporting each other. We should be helping people that are new in the industry. All of these things and frustrations are going through my mind. And I look at her page, and I won't tell you the name, but she owns a billing company. And I was like, you have to be kidding me. And I'm going on and complaining to my husband, who knows nothing about anything.
Sure, he loved it.
And, it just was very, very discouraging, like I said. And it was just really awful.
Well, how many times, though, have we even seen, or have you seen in your professional work, people come to you with problems that have been created by their billing company because they don't have any type of oversight? So even when you contract, like, this is kind of off topic, but it's just a good reminder that even when you contract a service out for your practice, such as billing, you have to have oversight to that, because you have to make sure that they're billing your stuff correctly, that they aren't just writing off your denials, that they aren't just, taking your denials and adding a willy-nilly modifier to it to try to get it paid and things like that. This is like such a huge reminder that they may have a company to do this for, but it doesn't mean they know how to do it and are doing it correctly.
Well, and it all depends on the personal knowledge of leadership, right?
Yeah.
Because a lot of owners, I have a lot of friends or acquaintances in this industry that know their stuff, and they're great, and they know when to ask. Just like if I'm doing a revenue cycle review and I don't know how a certain function works in a billing system, I'm not going to pretend to answer that. I'm going to phone a friend and try to figure it out that way. I'm not going to fake it till I make it.
Yeah.
So, with the answer, let me answer it, and then I'll tell you some of the other feedback that was just awful in that thread. But the reason the free charge is such a problem is because there's a lot of ways that this can be looked at beyond the fact that they want to give their friend free services. There's a lot of times where people want their friends and family to get things for free. They want professional discounts because their friend down the road is a different type of physician and he's his golf buddy. There's so many times, professional courtesy happens, all of these things. There's different ways. Sometimes the physician has a lot of good intentions behind what they're doing. They care about their patients. They know that they are, not very not very well supported from an economic situation, whatever. They may have social issues, things like that. So it's not always from a bad place where these
No.
physicians are looking at giving these services. But where we have to be incredibly careful, and where this entire thread just went into a dumpster fire, was the fact that we have, first of all, there's different laws in place that restrict the ability to just do this whenever you want. And then in addition to that, there's also different things that are built into different commercial contracts, for example, where the payers are saying essentially you have to treat everybody the same. If
Hmm.
you give a patient free services, or if you give a patient a 50% discount because they were your friend, well, we want the same. We expect the same. We're
Yeah.
contracted with you. Now, that sounds crazy. Everybody would be saying, that's an insurance company. They have money. They don't get free things, blah, blah, blah. But this is why it's so complicated and complex.
They still
And
want fair
yeah, they
treatment.
want it.
Like, just
Yes.
because they're an insurance company with money, I mean, doesn't mean that they don't deserve to pay a fair price.
Well, and that's the part that a lot of people just don't realize that it's in there. And this is something too. We were talking about research before. This is something where you can't necessarily just type in this question and you're going to get a word for word answer in the way you're expecting
Hmm.
to see it. You have to have the ability to dig deeper and pull out specifics for it. Now, some of the things that I want to call out from a legal perspective, and again, I'm not an attorney. I do a lot of work with health law attorneys. This is just things I'm aware of from the different cases I've worked on,
Yeah,
stuff like that. And
what
a
you've
lot of
seen.
us in the industry are aware of it. So a big one is the anti-kickback statute.
Yeah.
We can't be providing things for free where it's looking like with that friend down the road where he'll give you this service for free, you give him that one for free. That's
Yep.
going to be pretty bad, especially if you're then referring patients over to them and things exclusively and things like that.
Yikes.
That's going to be a problem. There's also things tied into the False Claims Act. And this is a part that not everybody realizes either. And when we think about it, it's something where when you are submitting a claim to a payer, they are expecting it to go through the process of, this is your fee schedule, this is what we're going to pay you, then we're going to tell you payment adjustment, whatever, patient out of pocket.
Yeah.
One of the questions that really was showing the person's lack of knowledge in that thread, they were saying it in a derogatory written tone, which can be hard to tell, but they were saying to me, this doesn't make sense. That patient is self-pay. They're not billing it to the insurance. That this has nothing to do with that, because everybody in the thread was like, oh, don't bill it to insurance, just put it in as no charge or put it in for a penny, and all of these comments that were 90% wrong. And that person's not even recognizing, they probably have no idea about these different things in the industry, but they're not recognizing that yes, the payers are going to dictate what you do in your practice, even with your self-pay patients.
Yeah.
You've got to have self-pay policies, you've got to have hardship policies, because if they are to question the actions you're taking, then they're going to want to see, okay, well, what's the policy, because that shows that it's available and being applied to everybody the same across
Yeah.
the board. It's also the same reason we have one fee schedule for an entire practice, so that there's not incentives in different ways. And that's the thing too, when we look at some of these legal issues, if you're offering free services, it's going to look as if you are incentivizing patients to come see you
Hmm.
because that provider will give you services for free.
Yeah.
And even if you have insurance, self pay or insurance, this is a problem. So I just really wanted to point that out because, again, reminder to stay the heck out of forums. I don't need to be in forums at all. I'd rather help people here
Why
through
does
my
social
membership.
media in general do this to us?
I
Like,
know, I know. I don't know what I was thinking, but stick to what you know. There were a lot of people in there that were giving really good, solid answers that were also referring to either their situations where they had to pay back penalties because they were caught, which everybody seemed to be ignoring, or people that were referring to actual sources
yeah,
like I was. So, you've got to have a source. You cannot just have somebody's word. You cannot just have an opinion. And, even for me, when people ask me a question, ask me what the source is. A lot of
yeah,
my members that have help in this way, I know that they have to then go back to leadership or they're going back to a physician who's already mad at them. So we talk through the answer, but then I also help them with the resource.
yeah,
And if it's not word for word, like we want to see it in our nice little tied up package, then we talk about why that's not possible in that situation.
yeah. How to
But
break that down.
yeah, yeah, but we got to be careful in forums. I've always said that a forum is not a bad place to go if you don't know where to start your research.
Yes.
I wouldn't go saying, "Oh, how do I do this?" because obviously that person got a lot of really bad answers. And even then, the person who asked the question went under all of the multiple comments that were there with mine and was like, okay, all of this aside, how do I code it? And it's like, oh my gosh, I got to get
Yeah.
out of here. And
Yeah.
they
No. Well,
they
and
did
people
eventually
will,
delete the post, by the way. So you can't go back and find this post. It needed to be deleted. Like I said, it was a dumpster fire,
I
but
feel like
it's a starting point.
in those situations, like I know that I've been in a situation before with an employer that I worked for previously, they were like, we need the answer to this very specific question. The answer to that very specific question was not out there. And they were not satisfied that I could not have black and white, word for word, verbatim, yes or no to their thing. Even though I said, because of XYZ, when you look at these things combined, this is not appropriate. They
Mhm.
were like, no, no. You need it. It's like they wanted me to go out there and find somebody who would say what they wanted to hear.
Well,
And
yes,
so
that's the thing.
that's what's
Yeah,
going to happen sometimes with these forums. They're going to be like, who gave me the answer I wanted?
yeah.
We're not talking about who gave me the accurate answer, or let's look at this from both angles. Like, okay,
Mhm.
this person just said, LOL, you're wrong in so many ways, but this person actually said, this is why you can't do this and broke down the reasons. Maybe that's the person I should listen to.
You
And,
would think so. You would think so.
but
But
no, it's probably easier to say, okay, you know,
they said what I
this is how,
want. My doctor
yeah,
wants me to do this. I'm going to go this route. Yeah,
yeah. And
yeah.
so it's kind of, sometimes, first of all, if you are in leadership seeking these answers and you have somebody doing that research for you and they come to you and say, nowhere says yes or no, but this is what I have determined through my research and this is the answer I have come to for this reason, that's probably worth listening to. Don't torture that person by then making them go try to find somebody to give you the answer you want. Sometimes your answer is no.
Right. Yep, I agree. All right. So we did go a little long in this one, but we had some good questions come up, and I'm stepping off my soapbox now. Um,
Don't slip and fall.
I know. Maybe I need to.
No,
But
we need to see it on camera so we can laugh.
oh, I know. I would be there
I have
laughing
to
as
tell
well.
you something hysterical. So, this weekend I went with some family to Disney, and they are a little bit more agile than I am, and they all decided to sit on this curb. And I'm like, yeah, I can sit on this curb too. And I get down there, and then I'm like, how am I going to get up from here? Well, as we're sitting there, a ride reopened that we had wanted to get on, and they're all jumping.
and leaving you.
Attempting to get up, and I had to like pause to collect myself halfway, and I'm like, where do I go from here? And, oh my gosh, I'm like, did somebody get that on camera? Please tell me you got that on camera, because we probably would go viral. But luckily I made it up without face planting it into the bush or without injuring myself. Oh, I hate to know how many people witnessed that attempt at getting up this curb, and it will be benches and chairs only for me from now on, or high wall curbs.
You have to practice a roll technique.
Well, I don't know if you've ever, this is totally off topic, but I don't know if you've ever been to Magic Kingdom and gone on the Tomorrowland speed. But don't do it. If you are over the age of 40 and have that piece, don't do it. You have to like roll out of that tiny car onto the sidewalk. Just be forewarned. Take my word for it. It may only have a 5-minute wait. Don't do it.
We're letting a little bit of our crazy show here. Sometimes when we laugh, like we said, we just get ourselves going. It's hard.
I know that's completely off topic and not related to auditing antics, but you can take my word for this one.
Okay, so as a final reminder, remember to check out the medical coding workroom. I will put that in the show notes. And then also, if you're watching on the screen here, you can go to stephanieallardconsulting.com/membership. You'll see the full membership there. And then use code Auditing Antics 26 at checkout, and that will give you 26% off. All right, so I hope you all have a good week, and we will see you back next week.